Hello, I'm Dr. Dan Alicata for the Joint Telepsychiatry Toolkit of the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. I'll be discussing safety and emergency considerations in conducting telepsychiatry with children and adolescents. The use of telepsychiatry modalities to provide psychiatric care for youth is expanding rapidly as healthcare providers increasingly recognize telepsychiatry's ability to reduce barriers in access to care experienced by many children and their families, especially in underserved areas. Through telepsychiatry, children can receive telepsychiatry services in multiple settings, including in their homes and schools, behavioral health clinics, primary care clinics, therapeutic foster homes, and even temporary shelters. Psychiatrists must ensure that appropriate emergency management procedures, which capitalize on local resources and are well suited for handling emergencies that may occur during telepsychiatry sessions, are established at each site to which they telecommute. Psychiatrists who wish to provide telepsychiatry services to children at traditional healthcare settings, such as hospitals and community mental health centers, need to become familiar with the infrastructure and emergency management protocols that are already in place at these sites. They should make adjustments to the infrastructure and protocols as needed to ensure appropriateness for telepsychiatry modalities. Psychiatrists who wish to provide telepsychiatry services to children at non-traditional healthcare settings, such as shelters for families and children displaced by natural disasters, will likely need to develop the emergency management infrastructure and protocols, including personnel roles. Telepsychiatrists comprise a core component of their patient's system of care, as do other patient site collaborators, such as clinical telepsychiatry coordinators, primary care physicians, therapists, school personnel, and other supportive staff and community members. Psychiatrists should become familiar with the resources of the local community and with patient site collaborators discuss whether and how the patient site utilizes these resources to best support emergency management infrastructure. In the event an emergency occurs during a telepsychiatry session, psychiatrists should utilize community emergency resources before institutional emergency resources. For instance, dialing 911 to report an emergency situation in a distant community is likely to be problematic and should be viewed as a last resort method of emergency management. On the other hand, enlisting patient site collaborators who can accept the responsibility of intervening in emergency situations, help assess youth, and refer them to higher level care if necessary, can be a timely and effective emergency management strategy. The telepsychiatry treatment team should also identify additional valuable community resources and incorporate them into their emergency management protocols as appropriate. For instance, there may be a local crisis mobile outreach agency that can be called upon in emergency situations, and community members such as school personnel who can assist with monitoring children as a follow-up to emergent care. Communication between psychiatrists and patient site staff is key to successfully managing emergency situations, as patient site staff generally have a wealth of collateral information about their patients to share with psychiatrists between telepsychiatry sessions. These staff would be involved in the discussion of medical care decisions. In addition, patient site staff, as well as the patient and the patient's family, need to understand the limits of confidentiality and mandated reporting requirements. The The telepsychiatrist and all patient site collaborators should know their roles in emergency management in case a child under their care during a telepsychiatry session appears to be or reports being at imminent risk of harm to self or others. However, all staff members should be flexible and, in the absence of any individual staff member, able to carry out emergency management procedures that would normally be outside of their role. In support of that aim, safety and mobilization procedures at the patient's site, while not always defined within the patient's electronic medical records, should be both accessible to staff for review and an integral part of their training. Finally, psychiatrists need to be able to effectively manipulate telepsychiatry technology in order to maximize video and audio quality to better assess signs of agitation and medication, alcohol, and drug side effects. In addition, they need to be prepared for the possibility that technology may fail while they are dealing with a child in crisis. If audio or video fails, psychiatrists should be prepared to quickly initiate a backup plan, such as calling the patient site clinical telepsychiatry coordinator on the phone immediately to tell them to enter the patient site room and ensure the patient's safety. With these safety measures in place, telepsychiatry with youth can be readily integrated into the mental health care landscape, even for youth obtaining services in non-traditional healthcare settings. I'm Dr. Dan Alicata for the Telepsychiatry Toolkit. Thank you for watching.